And the number of people who have died from COVID-19 in Indiana nursing homes has more than doubled in the past 3 weeks. 876 people have died in long-term facilities from the virus. That is nearly half of all COVID-19 deaths in Indiana. 13 new facilities have reported at least one death, according to data released this week from the State Department of Health. And Call 6 Investigates Kara Kenny found some families are taking big steps to protect their loved ones, and tonight she is digging in to find out what those numbers mean.
We first told you about problems surrounding Greenwood Meadows back in early April, and new numbers now show it's one of the hardest hit facilities in central Indiana. Dozens of people have died here from COVID-19. Gloria Benefield's mom, Violet, developed COVID-19 while living at Greenwood Meadows. This is a picture of Violet Benefield on April 5th before she got sick. This is her on May 20th. Her daughter says Violet is now negative, but she's still not feeling well.
She has a sore throat now and ear infection, and they haven't addressed that.
Gloria plans to remove her mom from Greenwood Meadows and move Violet in with her. 32 people have died at the facility, one of the highest death tolls at a long-term care facility in central Indiana.
I've already cleared out a bedroom for her to go into. We've already bought her a bed and everything else. But like I said, she doesn't get the care that is supposed to be given.
They're operated by American Senior Communities, the state's largest nursing home provider, which started posting numbers this month on each facility's website about cases and deaths. Greenwood Meadows also posted this video to YouTube showing various staff members emphasizing the facility has been communicating daily with residents and their families.
I believe this daily communication has not only created new relationships, but has helped our families have a better peace of mind at home, knowing their loved one is being continuously cared for.
American Senior Communities and its partner Health and Hospital say deaths are higher in their facilities for several reasons, including they're testing more residents than other operators, which means more deaths are identified as COVID-19 related. They operate a large number of nursing homes in urban areas where the virus is most concentrated, and they care for a large number of Alzheimer's and dementia residents who are difficult to keep separate and are especially vulnerable to COVID-19. At least 32 people have died at another Johnson County facility, Greenwood Healthcare Center. Their operator, Communicare, says they have higher numbers in part because they have a ventilator unit, which brings in patients with respiratory problems.
Well, I think when you just focus on the numbers, you really miss the big picture. It's true that the Greenwood facility has had those numbers of fatalities, and our thinking is that the vent unit and certainly the age and underlying health condition of the population there plays a role in it.
Communicare emphasizes most patients are recovering.
We had a single day high earlier in May of 115 residents who had been COVID positive. Many of them, a great many of them, had no symptoms whatsoever. But now we're down to about 25 residents in our isolation unit.
2 of the highest death tolls at long-term care facilities are in Johnson County. The health department tells us the 2 facilities are large and treat the sickest elderly patients in Johnson County. Many of these patients are in hospice and have chosen to live their last days in these facilities. For families like the Benefields, they're making the difficult decision to get their loved one out. Reporting in Johnson County, Kara Kenny, RTV 6.
Health and Hospitals Board has requested an independent review, which will provide recommendations to address residents' needs. You can read their entire statement in this story on the RTV6 app and at theindychannel.com.